All right, everybody, I'm Logan Alec, I'm a CPA, and today I want to talk to you about what's going on with healthcare in the United States. I know this is a politically charged topic. If you've followed my content, you know this isn't going to be about plugging Biden or Trump, but no matter who you support, it's clear that the US healthcare system has some structural issues. So in this video, I'm going to go over 3 reasons why healthcare in the United States is so expensive, and along with each reason, I will be considering possible solutions. And if you watch this video and you enjoy it, or you find it interesting, or even if you hate it, I would appreciate it if you give me a big old like, a big old thumbs up in the box below. All right, first things first, I want to talk about the data. There have been a lot of studies on this topic, but one that stands out to me is a report from a team led by a researcher from the Johns Hopkins Bloomberg School of Public Health. Basically, they compared what Americans pay for healthcare to what people are paying in other OECD countries. If you're not familiar with the OECD, it stands for Organization for Economic Cooperation and Development, and it represents a group of high-income countries from around the world. So I'm not going to read them all out, but here's the list of current members on the screen right now. Essentially, the point of this study was to contrast the United States with other countries in similar economic situations. Of course, our healthcare spending per capita is likely to be higher than healthcare spending in countries with lower GDP per capita, so it makes more sense to compare apples to apples rather than just comparing absolute values. And according to this report, the US spent $9,892 per person on healthcare in 2016, which was the most recent year I was able to find data for, so it could be even higher by now. Not only was that the most spending of any country in the OECD, it was the most by a really wide margin. Switzerland was second, and they spent just $7,919 per capita. So that means we spend almost 25% more on healthcare than the country with the second highest level of spending. When you compare us with countries that were closer to the average, Canada, for example, our expenses are actually more than double what theirs are. So it's clear that this is a problem, but what's interesting here is that it's actually kind of a new problem. The researchers point out that American healthcare spending per capita more than doubled in the 16 years going from 2000 to 2016. If you adjust for inflation, it works out to less than double, but still something like 56%, which is a massive increase in just 16 years. So it's not like this is an issue that goes back generations or something like that. A lot of this issue has really come up more recently. Now, on the other hand, you might think that we pay more because we get better coverage, but it's really unclear whether that's the case. In fact, almost 10% of the American population doesn't have health insurance at all. That's a lot better than it was before the Affordable Care Act was passed in 2010. So yes, we're making progress, but we still have a much larger uninsured population than many other developed countries, some of which have universal insurance programs that cover every single citizen. Okay, so that should give you an idea of what our health insurance looks like relative to other countries in similar economic situations. But it's hard to pin that trend to any particular cause. So in this video, I'm going to share you 3 primary reasons why this could be the case. Reason number 1, we pay more for the same drugs. Regardless of your political views, you've probably heard about the problem of drug prices in the United States, and this is definitely one of the most relevant factors here. This comes up a lot with insulin, and the data indicates that Americans spend much more than Canadians for what comes down to the same product. One study found that American insulin went from $40 per vial to $130 from 2002 to 2013, and another found the average cost of insulin increased from $2,900 to $5,700 over just 4 years from 2012 to 2016. So in the equivalent of 1 presidential term, basically Obama's second term, insulin almost doubled in price, and even before that, it was already more expensive than it was in many other countries. Now, another problem that this point leads to is the fact that people don't have an infinite amount of money. So if your insulin costs thousands of dollars every year, you might be put in a situation where you have to choose between treating your condition and covering other critical expenses. And in fact, Yale researchers found that roughly 1/4 of American diabetic patients report using less insulin than recommended because of issues pertaining to cost. Some patients have even crossed the border into Canada, where they can get the same treatment for as little as 1/10 of what they would pay in the United States. Of course, insulin is a high-profile drug here, but it's far from being the only prescription that Americans pay too much for. In September 2019, the House of Representatives Ways and Means Committee released a report detailing price discrepancies between the United States and 11 other places: the United Kingdom, Switzerland, Ontario, Japan, Denmark, Australia, Portugal, the Netherlands, France, Germany, and Sweden. For a total of 79 common drugs, Americans pay an average of nearly 4 times more money than citizens of these other countries. So this isn't the only reason our healthcare costs are inflated, but obviously a problem when you spend $4 for every $1 that's spent in another country for the same treatment. Reason number 2 why healthcare is so expensive in the U.S. is that Americans avoid healthcare, or they tend to avoid healthcare, due to cost. So as I mentioned in the Yale study, about 1/4 of Americans with diabetes have used less insulin than they need because they're worried about the cost. Obviously, that's a sign of how expensive the drug is here, but it also means that some of those people will end up in the hospital for more serious conditions because they weren't able to stay on the prescribed treatment regimen they needed. This is actually a common trend in the American healthcare system. People will avoid getting help when they need it, and what happens is they don't go to the hospital until things get really bad, and then they need more invasive, more costly treatment. One report that I've seen claimed that 32% of American families, so almost 1/3, decided not to get medical care at some point from March 2019 to March 2020 because they were concerned about the cost. And sure, they avoid the cost at that point. Maybe they don't have to worry about the copay, but what ends up happening is that their condition gets worse, and they need to spend even more when it finally forces them to get medical help. Another study from the National Institutes of Health discussed the importance of preventative care and claimed that the focus on prevention and wellness and the additional time, attention, and access to physicians, i.e. higher quality of care delivery, will lead to better health status, lower emergency room visits and hospital utilization, and ultimately lower healthcare expenditures. They recommended a few things that could fix the problem, including a higher ratio of doctors to patients, longer visits with a personal physician, and proactive health coaching outside of appointments. Now, what's interesting about this study is that when they put these ideas into practice, they found that costs went up dramatically in the first year, but by the third year, they had already dropped to essentially the original level. And this is the problem with systems that focus on short-term profits. Of course, it seems like you're being more efficient by having doctors see as many patients as possible for relatively short appointments. But the result of that kind of strategy is that people will be disengaged from their own health and develop more serious problems over time. So if we could revamp healthcare to give people better access, even though it sounds like things would get more expensive, that might only be a short-term issue that goes away once people start to see the benefits of preventative care. All right, so hopefully that clarifies how much of our healthcare costs stem from higher drug prices as well as less preventative treatment, but those don't explain the gap on their own. Another factor that plays a really crucial role here is the difference in administrative expenses between the United States and other developed countries. If you've ever had to seek medical care in the US, you know it can get complicated quickly, especially when your insurance company may go to great lengths to avoid paying for something that you thought was covered. Of course, there are a number of reasons for this issue, but the most obvious one is how hopelessly fragmented our healthcare system is. Some people have private insurance through their employers, some people pay for insurance directly, some people are on Medicare or Medicaid. Some people are on the Indian Health Service, some people have public insurance through the Affordable Care Act, and so on and so forth. Each of these providers has their own protocols, their own coverage, their own rules, which makes the world of healthcare extremely difficult for the average person to navigate. And on top of that, each separate provider needs administrators to interface with the other providers. This trend is really clear in these graphs here. They're from the Peter G. Peterson Foundation, and they found that the United States spends more than 5 times as much on administration than the average developed country. And on the other hand, we spend a little more than 1/2 of the average on long-term care. So as I mentioned earlier, this is money that could be going to improve preventative care or to improve access, but is instead funding our massive healthcare administration system. And this is another one of the main arguments for single-payer healthcare through Medicare for All or something like that. Of course, it sounds like giving everyone health insurance would be really expensive, and as I discussed earlier in the video, it's true that providing better care could lead to higher short-term costs, but switching to a simpler system could also save us hundreds of dollars per capita on healthcare administration, and if we put those savings toward more effective care, then we could save money on the other end by improving outcomes. So even though you'll hear that private healthcare is more efficient or that we can't afford public health insurance, the reality is that our healthcare administration is already far less efficient than every developed country that has switched to a single payer system. All right, everybody, I know this is a charged topic. Obviously, there's a lot to cover, but hopefully this video gave you a better idea of why we spend so much money on healthcare. Now, if you're concerned about healthcare costs, and if you have a high deductible health plan, I would recommend looking into a health savings account or HSA, okay? HSAs offer really valuable tax benefits. Personally, I have a health savings account and I max it out every year, even though I've never spent any of those funds on healthcare because I love getting that tax-free growth in it. I don't have time to talk about the details of HSAs right now, but I will cover them in another video in the future. All right, everybody, thank you so much for watching this video to the end. Remember to give it a big ol' like down below if you like what you saw, and I will see you in the next video. Bye-bye.